Hey everyone, this is Sally Hayes with Matrikas. We are a directory of fertility, pregnancy, and postpartum providers. And today we are here with one of our members, Abigail Prushansky, who is a certified nurse midwife. Abby, can you give us, I know you have a lot more letters behind your name, so can you do a more formal intro for everyone?
Sure. So I am a board certified family nurse practitioner and yes, a board certified nurse midwife. I have many years of other things like lactation education and counseling, childbirth education and counseling. And now, obviously, with being a midwife, it kind of just encompasses all of that. And at the end of June, I will be officially done my doctoral project. So kudos, and then that's it. No more for me. No more letters.
Are you sure?
I know.
Everyone says that and then they go back to school for something
We
else.
just can't stop, right?
No, it's true. It's true. So I want to talk, you have so many things going on and you're so knowledgeable, and every time we talk, I learn so much from you. But today I wanted to talk a little bit about perimenopause. And, for me, I'm 48 and I'm in that section, and all my friends are kind of starting to talk about it. But the question I get all the time is like, who do I go to? Like, who do I talk to? So, can we start from that perspective of maybe what you should look for and also when you should start talking to someone and who you should talk to?
Definitely. I think the biggest thing is that, um, the average age of menopause is 45 to 55. And what that means is your period has stopped. Then there's a whole section of our lives before the period stops that's called perimenopause, right? Like the before menopause. And that can last up to 10 years. So you can have a woman as early as 35 start having perimenopausal symptoms. The problem with that is most of us hawk it up to life. Oh, I just didn't eat well. I drank too much alcohol. I had a fight with my lover, my husband, my partner, my children. I'm stressed out at my job. Oh, I only exercised 3 times this week instead of 6 times. And I shouldn't have had that extra thing of cookies. So, there's a lot of things I think that we put our symptoms out there instead of actually taking a second to say, "Ooh, actually, maybe it isn't that I ate one extra cookie and I didn't work out 6 days and it wasn't the fight with my husband or my children. Maybe actually it's my hormonal fluctuations going crazy and haywire that's causing a cascade of events that are following." And the hardest part is those symptoms aren't just linear, right? So we like to think perimenopause, menopause, oh, it's this like nice, pretty decline until you just period stops. And it isn't. It's this weird, like jagged, and then okay, you have a little bit, you're like kind of cruising, and then it's back to this. And so you're living in these unpredictable feelings of earthquakes all the time, right? You've got little ones, you've got big ones. And then usually women in their mid to late 40s or early 50s start saying, oh, maybe actually it's that transitional time in my life, right? Without realizing that all the years they've had before that were actually just due to the slower transitioning down of those.
So, what are we looking for? Like, what would you say the top two symptoms are going to be?
Well, of course, it varies from woman to woman, but I would say there's a handful of symptoms that I get a lot of. Sleep is a big one, right? They start to say, oof, I wake up at 2 or 3 in the morning and I can't get back to sleep. Like, I don't understand. Like, I've always been a great sleeper. I go to bed at 9. My nighttime routine hasn't changed. I'm not increasing my caffeine or my alcohol. I can't go back to sleep. Like, I'm up at 2, 3 a.m. every day, and then I'm exhausted all day, right?
Yep.
And again, it doesn't matter what they do. Like they could try to go to bed a half hour earlier, a half hour later. It's this weird disruption in our like circadian rhythm from our hormones that just stop us from sleeping well. So that's a big one. Another really, really big one is mood changes. Almost PMS like, but a little bit worse, right? And a lot of women will come in and they'll say, I know that I love my partner and I know that I love my children, like the people in my home. But sometimes I have this deep irritation inside me, this like rage almost, and I don't like anybody. Like I almost get to a point where I feel like if I didn't see anybody, meh, I'd be fine. She's like, and I know that like that's not like logically, I know, and emotionally, I know like that's not true. But every cell in my body is just telling me differently. And they're happy one minute, they're crying the next, they're screaming another. They have little to no patience now. And then I'd say the third biggest one is like the brain fog, almost like when you were pregnant and you walked into a room and then you couldn't remember what you went in there for. It's like that all over again, but a little bit elevated. I mean, I have women who, are CEOs running companies who are like, I'm trying to host a meeting and my vocabulary, it's like suddenly I can't remember words or I can't remember my train of thought. I don't remember where I was going with this, right? They just feel not like themselves anymore. So I say if I had to pick three, those would probably, and then obviously weight gain, abdominal girth, weight gain. No matter how much they diet and exercise, they can't lose it.
Yeah. Yeah, that makes sense. I could understand that completely. What should you do if you start kind of experiencing these symptoms?
Well, I think the biggest thing is obviously start talking to whoever your provider is, right? Whether that's a primary care doctor or an OBGYN or a urologist, whoever. I think the biggest thing is to also make sure that the person you're talking to believes in perimenopause. There's still a large number of providers out there who don't believe in hormone replacement therapy, who think you need to just suck it up. It's the time and transition of your life, and you'll get to the other end. It doesn't matter anymore. So find someone that you feel like aligns with you, even if you don't really know what that means to you yet, right? Like maybe you are a hormone replacement person, maybe you're not, or maybe you just don't know your options. So if you go to someone and you feel dismissed, which happens a lot in medicine, even not just about perimenopause, well, don't stop there, right? Go to someone else or dial up some friends. Because if you're going through it, there is someone else in your friend group who is, they're maybe just not talking about it.
That's good advice. And are there tests? Like, are you going in and getting tested? Are you just
You can.
talking? Okay.
I mean, up until actually a new research article just came out discussing how obviously some women are poor absorbers for transdermal estrogen, but we're focusing on symptom relief. So if we're giving you dosage of hormone replacement therapy and your symptoms are alleviated, fantastic, woohoo! And we're protecting your brain and your bones and your heart and everything else for longevity purposes. The article that just came out talked about that some women aren't getting therapeutic effects from their estrogen patches because whether it's an adipose tissue issue, a laxity skin issue, or they're just malabsorbers that way. So that would become a question to talk to your provider about, right? If you decide to do a patch and you're not feeling any better and you've been increasing the dosages, right? Now it makes sense to do some testing on people. Whereas before we'd be like, I don't really need to know. In all honesty, most of your hormone levels are going to come back looking in a normal range, especially for perimenopause, because our estrogen and progesterone have ranges according to our weeks of our cycles. And your level of estrogen where you feel really great might be different than my level of estrogen where I feel really good. So I think it's nice to have a baseline hormone panel. Obviously, yes, you want to look at your hemoglobin A1C. Are you pre-diabetic? You want to look at your cholesterol, or is that through the roof? Because then there's other lifestyle modifications and changes you need to make. But the labs don't necessarily dictate dosages or route per se.
Interesting. And then what if you don't want to do hormone therapy? Or I know that some people aren't necessarily a candidate for that. Like, where would you go?
So there are some non-estrogen type things out there that some breast cancer survivors have the options of using. If you have family history of breast cancer, it doesn't make you, before they used to be like, oh, you're not a candidate, but that's not the case any longer. And if your complaints are strictly vaginal, vaginal estrogen is not systemic. So even somebody with history of breast cancer can use vaginal estrogen
Oh, that's
because it's
interesting.
not, it doesn't go into the bloodstream in the dosages that it is. So there's a lot of options out there, even whether you want to do non-pharmaceutical. The other things, they're not going to, they can help with some symptoms, but they're not replacing your estrogen.
That makes sense. That makes sense. I think it's so interesting. So if you're going through this and you're not really sure what, you're experiencing some symptoms, but you're not really sure if you're fully in this or not, and you get dismissed from your primary, what next route would you do? What,
I
who
would find another doctor.
just keep going and just
Yeah.
keep finding
I
people.
would. There's a couple great websites. There's something called the NAM Society, which is the National Menopause Society. You can go on there and sometimes find a NAM certified provider. Somebody that is not NAM certified does not mean they're not a great provider. It's just if you're like, I have no idea where to begin my search, you could start there. And yeah, I would. I mean, do your own research, right? There's books, there's research articles. I wouldn't necessarily just go to Google. But worst case scenario, I mean, Google's not going to dismiss you like your doctor did. Um, and then take control of your own health, right? I mean, I find it so fascinating because I actually looked up the average age in the United States of when a woman becomes or gets put in a CEO position, which is early 50s. And if you think about that, right, they've done a lot of work up until that point. Now they're being hit and bombarded with transitional life things while they're at the top of their career, which makes sense why the burnout for a female CEO is faster than a male. It isn't that they can't do the job or do it well or handle stress and pressure, right? But their hormones are kind of against them at that age. So I looked at it because I thought, oh, if you could keep a woman at the highest peak function that she could be at, right? Like why not? And I just felt that was so fascinating, because it's not men don't have to go through this, okay? They're like midlife crisis is they go get a Porsche and upgrade to a 20-year-old wife, right? Ours is like, wait a minute, I'm gaining 20 pounds and now I'm losing hair and I can't sleep and I hate the world and like, what is happening? And the fact that they're able to still maintain. I mean, you look at some of the female CEOs in the world and they're doing a phenomenal job, right? And then I think, oh, how interesting would it be to know which one of those were on hormone replacement therapy during that phase of their life, and then which women didn't know any different.
And then if you're doing hormone replacement therapy, are you on this forever? Does it shift and change? Do you need to go in and get it regulated and change your dosage?
Yes, I would say for people to remember that their body is still making hormones themselves. So when we say replacement, it doesn't mean that you're like empty, right? We're adding to what your body's producing. Your body's just no longer producing a high enough level. So yes, I do tell women there might come moments where remember we're like this, so we're kind of leveling you out, and then your body's going to produce less, and so you might need to go up, and then your body might produce less, and you might need to go up, or that dosage might be the best that might work for you, no matter what. That's the hard part about it is it's so not a one size fits all. And that's why we're treating the woman, right? That's who I'm listening to. Oh, your hot flashes are gone. Great. You're sleeping 100% better. Great. You're no longer mad at your husband in the world and you don't want a divorce. Great. Right. Wonderful. That's what I care about. And yeah, I check in with them. If they start it, I check in with them at 3 months because I want to make sure the dosage is right. I tell everyone in all things, you need 3 months. You need 1 month where your body's going, what's this? Then the second month is your body saying, all right, I guess this is my new norm. I'll get used to it. And by the third month, you should definitively see improvement. Most women will see improvement in that first month, but I don't ever promise them that because there's always some people it just takes longer. Or you get to the 3 months and you're like, my hot flashes are gone, but I'm still having, A, B, and C. So, okay, let's try an increased dose and see if the next 3 months we can get those symptoms under control, And then sometimes where people will go, oh, that was too much. Now I want to come back down. So it's very much like a tango dance with somebody. And you can't be a good partner if you just don't ever see each other. I mean, there are plenty of providers that are like, here you go, and come back to me if you need anything else. Whereas I prefer the 3 month check in. And if you're doing well on that dose, I'll see you in 9 months.
Yeah, that's amazing. One other thing I want to talk about is all the work you're doing with your Morpheus,
I'd love to talk about
specifically
that. So
for
love to talk about that.
incontinence.
Yes. Okay. So I will caveat it with this is in practice, I started noticing almost every woman was having a similar complaint. And by the way, that didn't matter if they were 32 or 82. Okay. They were having stress, incontinence, mixed incontinence, or urge incontinence, right? Stress is we squat, we pee a little, jump, we pee a little, sneeze, cough too hard, we pee a little. That's stress. It's a stress of the muscles that weakens the pelvic floor that lets a little bit of urine out. And then urge is that feeling, oh, I need to pee. And the urge is so bad. I have to pee. I have to pee. I have to pee. I have to pee. If I don't get to the bathroom, I'm going to pee my pants. And at some point, for most of them, they get to that place where they have some urine leakage before they get to the toilet. And then mixed, you can have a little bit of both. So, yes, it comes with age, especially with a lack of estrogen. It comes from pregnancy, like weakness in the pelvic floor. But you don't have to have been pregnant and have babies to have incontinence. I think sometimes that's what we think, and that's not true. I mean, I have so many women who have never had kids, and they're like, I don't understand. Why am I having this issue? It's like our age. We get weaker as we get older. And as many of us want to think we have really strong pelvic floors, we really actually don't.
Yeah, I think that's like one of those things people don't talk about so much.
They don't. They don't. Listen, it's embarrassing for some people, right? And so that's why I open up the conversation about it. I'm like, all right, tell me, how's peeing going? Are you having this? Are you having this? Are you having that? Um, and then I kind of get it out of them a little bit because the sanitary pad industry is a $2 billion a year industry. So they make money on us suffering. Okay. Nobody wants us to get better. I mean,
Right.
look at our country as it is.
Right.
Nobody wants women to be at the top of their game. So the fact that InMode is the company that created Morpheus, and originally it was aesthetic, face, body, but they have a vaginal probe, and the vaginal probe, in theory, is exactly the same. It's microneedling with radio frequency, and you are enhancing and rebuilding collagen, which is helping to restructure the cells, especially if you're having vaginal atrophy. And it helps with urinary incontinence symptoms. And I'll be honest, even more so than what I anticipated for my people that I've been doing. So I'm really, really over the moon for them. I mean, I'm having my clients texting me being like, oh my God, I did ballet Pilates for the first time since I was pregnant and I didn't pee my pants. Oh my gosh, I just had sex and it was comfortable for the first time in 2 years. I think you saved my marriage. Oh my gosh, I no longer feel like I have this urine smell that I know maybe other people didn't notice, but I noticed. And I just think it's such a great tool. Of course, like it's crappy. Nothing's covered under insurance in this day and age. So it is all out of pocket. But if you add up the amount that you probably spend on sanitary pads, if you really do have incontinence issues over the length of however many years, the cost doesn't even compare. And most people are getting really, really good relief even after just one session, but it is a series of three and they build on each other. And so InMode's clinical trials showed about up to a 30% improvement on symptoms after each one. And then our bodies will continue to create collagen 6 months after the last treatment. So I can't promise anybody the length of relief they'll get, but most of my clients are getting anywhere between 6 to 18 months of relief. And that's huge, depending on the severity of their case, right? I mean, that's huge that they are no longer having to worry when they go to something and scour where's the bathroom, pack the extra pads, or wear a Depend, or pack baby powder and perfume spray. And it's a huge quality of life change. But we've been told, just like in menopause for so long, you just, it's part of life, get over it. And it's not the case. It's not the case. And I just wish more people understood it more.
Yeah. And how long is a session? How long would one each
So
session be?
I numb you. No, there's not
That
large
was going to be the
needles
other
coming
question.
at you, folks. You numb for about 30 to 40 minutes, and then the procedure itself is about 15. So you're here for an hour. That's it. You'll be numb for hours after. You'll have, depending on whether you're perimenopausal or menopausal, some light spotting. More of my menopausal women are having more spottings. Most of my perimenopausal women have like no blood, but it is a possibility. And for my menopausal women, they'll have spotting 1 to 3-ish days. They'll also have anywhere between 1 to 3 days of like a leaking. And that's a little bit of like a light brown, a light yellow. And it's mostly a mixture of the fluids going to the area for healing purposes. And then as well as I treat right on the urethra. So some of that is just the urethra healing. So like burning, if they pee sometimes for a day or two, depending on, the urethra healing is also normal. And there's like no downtime. There's just no sex for a couple days, no tampons or anything up there for a couple days, and they're good to go. And it's so great even for my perimenopausal women, just for comfort with sex. Like it's not just about stress and incontinence. A lot of us in our older ages, we still want to have vibrant sex lives. It's just uncomfortable. And so this has really allowed a lot of my clients to keep that intimacy that they want in their relationships.
Yeah, that's amazing.
Yeah.
I always love talking to you and I love hearing everything you do. And I know you do a ton more stuff that we could also talk about, but
Oh, I know. We're short on time.
another episode. So can you just let everybody know where they can find you?
Sure. So my office is located in Torrance, California, and I'm right across from the hospital, Providence Little Company of Mary. And I'm in my office a couple days out of the week, but I very easily make things work based on people's schedules. And yeah, so you can call my website. It's just the fullcirclepremiumhealth.com, and my phone number's on there, emails on there. Um, yeah, just come and see me, hang out. I mean, it's like this. I might be doing a vaginal Morpheus, but we're chatting for a whole hour. More like a spa. You get a face thing, you get the weighted blanket, you get an Alexa and what is it, the essential oil diffuser. Like it's an experience.
Amazing. I love it. I love it. Do you ever do virtual sessions or are you only in
I
person?
do. I do
Okay.
virtual.
Okay.
However, that's with a caveat. If you're going to be my client and stick with me, because I obviously do primary care concierge, that I get at least one in-person visit with you first,
Okay.
preferably. And then, yes, if it's like for a hormone consult in person, 45 minutes, we chit chat, we go over everything, you get some blood work done, I give you your prescriptions, and the rest of the follow-ups are definitely can be telehealth, unless you want to come in, right? Then you can come in. But a lot of them, if they're cruising, it is a very quick 10-15 minutes. I'm doing great. My symptoms are great. I don't need a dosage. Okay, wonderful. Here's more prescription.
Cool. I love it. Well, thank you so much. I appreciate your
Thank
time.
you for having me.
And yeah, everybody go check out fullcirclepremiumhealth.com and check out everything that Abby does because it's a lot.
It's too much.
Thank you so much.